There's a big push at the state capitol this session to prioritize maternal health, but efforts to establish a data registry to better understand what causes women to die during or after pregnancy are at a standstill. Our investigation 2 years ago revealed problems with the way data is collected and tracked. As Arzo Dost explains, a state lawmaker says legislation she filed could prevent future maternal deaths and near deaths.
I was very scared. I kept telling them to save me and my baby boy. And some of the nurses prayed with me.
Jamie Brown Rosas says she sent this video to her parents after giving birth to her baby boy. She says she had complications during delivery and had to have an emergency C-section.
I'm so sorry. I haven't really talked about this.
6 months later, reliving it is still hard. The mom from the Houston area is a HELP syndrome survivor. That's a serious pregnancy complication that affects the blood and liver. She says she had been closely monitored during her pregnancy because she was also diagnosed with HELP during the birth of her daughter more than 2 years ago.
You think this is a completely natural occurrence to be pregnant and to have your baby in the hospital, and when it's not, it's very scary, and it's even scarier when you could possibly lose your life, lose your baby.
I've lived this. And at the time when, in 2012, when I had my daughter and almost lost my life, I had no idea what the statistics were.
State Representative Sean Thierry from Houston refiled a bill this session that would create the first statewide online maternal mortality and morbidity data registry. A KXAN investigation in 2019 found problems with how the state tracks maternal deaths and near deaths.
We had inconsistent data in Texas. The collection process was not the same. For example, if a woman died 43 days after giving birth, that was not considered a maternal mortality, whereas the woman who had died 42 days before would be.
Thierry says the web portal would collect and store data from hospitals and other healthcare providers across the state on deaths during or within 1 year of delivery and near deaths. It would also include high-risk conditions, complications, and other health-related details.
If we do not begin to use a uniform process and start to collect this data in real time, we're going to be talking about this for years to come.
Thierry says the data can lead to programs and services to improve outcomes. Jamie says she's grateful she survived both deliveries, but adds there needs to be more awareness about complications.
I don't want anybody to have to go through what I went through. I don't want anybody to have to wonder if they're going to come out of the hospital alive.
Arzo Dost for State of Texas.
Representative Thierry says funding for the data registry would come out of the state budget, which already has set aside money for improving maternal care. We have a closer look at the bill and our Mothers Erased investigation, linked to this story in the Texas Politics section of this station's website. The bill will soon get a hearing in the Public Health Committee. Last session, her bill cleared the same committee, but never made it to the full chamber. A bill to expand Medicaid coverage for new Texas moms won approval in the House. It passed with bipartisan support, but as the bill moves to the Senate, some Republicans are raising concerns about costs. Wes Rappaport explains.
Applied for Medicaid when I first found out I was pregnant, and it definitely was a big help from the very beginning.
Claudia Nungaray's pregnancy was tough. She battled high blood pressure and faced mental health challenges after giving birth to Kale, her firstborn, in November. Medicaid helped cover costs for doctor's visits during and after her pregnancy.
I use it mostly, of course, for my mental health visits with my counselor, my therapist. And I'm able to continue taking my medication for my, my mental health as well.
Ordinarily, she would have lost Medicaid coverage after 2 months, but federal COVID waivers prevent moms like Claudia from getting kicked off of that insurance coverage for now.
Women without comprehensive health care is the #1 cause of death amongst women after pregnancy.
Dallas Democrat Tony Rose's bill would extend Medicaid coverage for new moms until their baby turns 1. That was a key recommendation from the state's Maternal Mortality and Morbidity Review Committee. State enrollment data shows the bill would benefit over 130,000 Texas women each year. It would cost the state nearly $84 million over the next 2 years and more than $175 million in the 2 years after that. More than 24 Republicans voted no, including Rockwall County's Justin Holland. In a statement, Holland said in part, pregnant women in Texas could be better served if time and resources were spent on other solutions, adding, the state has focused its resources in other ways like the Healthy Texas Women program. Nungaray says her coverage was critical.
I don't know what I would have done without it.
I'm Wes Rappaport for State of Texas.
House Bill 133 is part of a package of a dozen priority health care bills in the House. Another one that passed this week was House Bill 4 to expand access to telemedicine. The bill by Amarillo Republican 4 Price would make waivers granted during the pandemic to expand telemedicine permanent. It now heads to the Texas Senate. Legislation to allow Texans to carry handguns without a permit takes a big step forward at the Capitol.
What we're seeing here today is completely contrary to what was promised.
Why some lawmakers are speaking out and calling the move a broken promise after a Texas tragedy.